Hello and welcome back to Lakshmi Eye Hospital's YouTube channel Lakshmi Eye Care. I am Dr. Krishna. Now we were discussing about diabetic retinopathy. Now what happens to the eyes in diabetic retinopathy? Most people know that diabetes affects only your sugar levels, but did not know it can silently damage your eyes and kidneys. This condition, which causes damage to the eye, is called diabetic retinopathy. And today I'll explain what really happens inside our eyes when we have diabetes. Our retina, the back part of the eye, as I shown you in video number 1, is like the film of a camera. It needs a healthy supply of blood through tiny vessels to work properly. But when sugar levels remain high for a long time, these delicate blood vessels start getting damaged. Think of these vessels as small water pipes. When sugar stays high, the walls of the pipes weaken, causing small leaks. This is where the tiny spots or fat deposits appear. Some pipes get blocked, reducing the blood flow to the retina. This stores the parts of the retina of oxygen. As a result, the eye tries to grow new pipes or new blood vessels. But these new blood vessels are fragile and weak, and they may break and bleed very easily. This chain of events is what we call as diabetic retinopathy. We usually talk about two stages: non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy. This is the early stage of diabetic retinopathy where we see small leaks, swelling and deposits. Many people do not notice any vision problem during non-proliferative diabetic retinopathy. Proliferative diabetic retinopathy. This is advanced stage where those fragile blood vessels bleed and may even cause scar tissue that pulls the retina and cause retinal detachment. This is when people suddenly lose their vision. So why it matters? The scary part, you may not feel anything in the early stage. By the time symptoms show, like blurred vision or sudden bleeding inside the eye, it's often very late. The good news is diabetic retinopathy is preventable if caught early. Regular eye checkups, good sugar control and timely treatment can save your vision. So, if you or your loved ones has diabetes, remember this: control your sugar, never skip your annual eye checkups. Visions once lost cannot be regained. If this video helped you understand diabetic retinopathy, do share it with someone you know who has diabetes. And don't forget to subscribe for more clear explanation on your eye health.